Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So I'm supposed to go back to work in 3 weeks. I'm still struggling with symptoms like spotty headaches, dizziness, eye pain, ringing ears, tiredness, neck and back pain. Will I lose all of my progress when I return?
These questions are...
Yeah, and this is not the... Well, here, maybe I'll just say a couple things, Cam, while you formulate your thought.
Sure.
So there's like this catch-22, and I learned this when a lot of my patients went down to a clinical at University of Pittsburgh, UPMC, where some specialists and experts in concussion have had this kind of really well-known, famous clinic there. And their approach is they do a kind of a psychological evaluation, and then they basically just say, what bothers you? Go do it. And the patients are like, what? And at home, they struggled with that before. Now, for a percentage of people, that approach works because it's almost like you have to kind of push through some of these barriers. Now, we've refined that process, I think, because not everybody is able to just go and do those things. But if you've set my belief, and this is my opinion now, and not everyone may agree with me, I think if you set the foundations that Concussion Fix has really tried to lay, you set those foundations first, and then you're in a better position to go and try to do something like go back to work. Ideally, what you would do is you would test and gradually work up to the type of work that you're going to be doing. So if you're going to be doing a lot of screens and you at work and you haven't done any screens now and you're going back in a week, then that's going to be a big curve. That's going to be a big learning curve for those systems. I always suggest try to replicate some of the things you're going to be doing at work and work your way up to the type of responsibilities and time and duration that you're going to be doing over the span of a month, ideally, or at least 2 weeks. And then you can kind of gauge how am I going to be. But there always is the chance that you're going to possibly have a setback if you overdo it. But there also is the chance that your body just needs a little bit of that push if the foundations are in place, and you're going to then be symptomatic, but your functionality is going to get better. And then what you'll notice over the next couple of weeks or even couple of months is that those symptoms will go down and your functionality will stay the same. So it's kind of like this: I go back to a new level of function and my symptoms increase, and then my symptoms should decrease as my function continues to increase. That's kind of the trajectory I notice with my patients. I don't know if Cam or Melinda want to add anything to that.
I just wanted to echo that as a parallel for how anxiety works too, right? So we want to gradually expose ourselves to things that we feel fearful of when it comes to our symptoms. And over time, this process of habituation happens where things that used to bring on anxiety no longer bring on that level, yet our functioning is increasing. We're actually engaging in things that we weren't engaging in before because we were fearful. So it's this kind of a parallel approach that can really support a regaining of functioning. And often that just comes with pacing things out in a way that's going to work for you. So, if the return to work is in 3 weeks and you don't do any of the pacing or the reintroduction until you're back in the office, you may experience more challenges than someone who's, prepared to sit in front of say you have a computer job that you do like half an hour a day and then an hour a day and then an hour and a half, and really kind of boost that tolerance, right, to the stimuli that might be creating some symptoms for you. That also, as I mentioned, parallels and it works simultaneously with anxiety and fear around getting those symptom flares. Because the more we can build confidence that we can do little bits without creating the symptom flare, the more likely we are to try and do it again next time.
Yeah, I agree with both both previous opinions. The question that I have in these things is, okay, what have you done? Where are you in the program? Have you built these tools, right? Have you done the work to build these tools? And if not, then you may not be in a place where work is that's where you, like, you know what I mean? You kind of have to build this stuff up when you don't have that looming over your head, because the stress of that can just make it harder for you to do the things and build the tools. So generally we have, like, my typical thing is, like, if I have somebody that's been off work for 6 months, let's say, I'm not going to just set a timeline to be like, hey, you're going back full time 3 weeks. Like, it's just not going to, it's not going to be a good way to do it. So usually what I'll do is say, okay, set your return to work for, 2 or 3 months from now. In the meantime, start building the tools that you have that are in this program, right? Focusing on all the stuff in Melinda's modules, getting your diet clean, exercising regularly. But then in the meantime, what you want to start doing is take the demands of your job and start doing those things at home and increasing the time that you spend on them. So, I would start with half an hour of computer work if it's a computer-based job. Then you gradually increase that to an hour, and then you're doing 2 hours, and then you're doing 3 hours. And so you're building your tolerance. You're also building the foundations that you're going to need for when you go back. You're building the tools for if things get overwhelming, you know how to handle it. And then when you go back, we typically recommend that you do like a 3-day-a-week schedule. So you start with Monday, Wednesday, Friday, and you start with 2 hours Monday, 2 hours Wednesday, 2 hours Friday. So that you always have Tuesday and Thursday off to recover if needed, right? And then after a week, you can add another hour. So Monday, 3 hours, Wednesday, 3 hours, Friday, 3 hours. And you keep gradually adding an additional hour to those 3 days. So you always have Tuesday and Thursday off. Once you get up to 8 hours on each of those days, then you add 2 hours to the Tuesdays and Thursdays. So you always still get most of the day off, but you still have a little bit. And then you build up the Tuesdays and Thursdays until now you're back full time. Now this could take, 5-6 months to actually build that up. But that's an important aspect of it. So it's just not throwing you into the fire. Because a lot of times if you're stressed about it and you haven't built the foundation properly and all of a sudden you're thrown into full-time work, that could be a lot.
I'm also thinking, Cam, maybe you can comment on this too about, I'm reading through the lines here because there's some other comments from this same individual. And I'm thinking about when you first get that notice from insurance that you're being sent to work. And I'm hearing that creates a lot of anxiety. And suddenly you're like, oh my gosh, this is what I'm being asked to do. And I don't think I'll be able to do it. So I'm curious whether or not, one thing we can highlight, and this is relevant for other members too, is this sense of when you're at, so say you're coming up to the point on short-term disability where you're going to have to move into long-term disability. Oftentimes this is a really stressful period for people because they're not potentially healed enough, they're not ready to return to work, and this creates a lot of the chaotic thoughts and concern about how am I going to go back and meet these expectations? So I always sort of invite people to really have a frank conversation with their disability coordinator, whoever's following them, to say what your capacity is at this time. Oftentimes they are willing to work with you, but I find a lot of clients I work with anyways are hesitant to ask because they're really worried about what that means financially for their families or what that's going to mean for the security of their work. So increasing communication with your disability coordinator, your insurers, they will work with you to a certain extent to help support you. I mean, their goal is to get you back to work. So I always really encourage people to have those conversations versus sort of just freaking out when, which is a really normal response, but freaking out when you get this notice that it's time to go back to work. This is another key time this occurs is when the 2 years that's offered to most people following long-term disability is ending. So when these, milestones or these, certain time periods are occurring, remembering that there are ways to go about this to support a gradual return to work. Just because you get a letter that says, I'm just making this up, but just, because you get a letter that says it's time to return to work, you've been assessed that you can return to a full capacity. That doesn't mean you have to do it right away or jump in 5 days a week, because that's also not going to support your recovery. So I think that's also an important piece, and just piecing together a few things from this member.
Yeah, I would see if you can reach out to your insurance provider, whoever your adjuster is, and just say, can I have a gradual return so that I don't just flare myself up and end up back, having to take full time off. Like, it would be really good if they could work with you to have a gradual build. And if you can help to structure it, and you structure it like, 3 days a week for a few hours, and then 3 days a week for a few more hours, and you just give yourself that break in between, like, that's a really good structure that works, and it's really manageable to do for pretty much anyone. See if you can do that. But if not, try to get whatever you can in terms of a graduated return, right? Part-time and gradually increasing those hours, I think, will just take a little bit of weight off you. And in the meantime, just work on the foundations, work on the diet, work on the mindfulness, work on kind of calming things down a bit, and try to do a little bit of whatever your job will entail. Try to do a little bit of that type of work at home when you can take frequent breaks and, go at your own pace and just gradually build, right? Don't try to sit down and power through an 8-hour day in your first day, right? Start with very limited time and just gradually increase from there, so that you're feeling a little bit more confident when the 3-week time comes.
Yeah, I'm here. So the member just wrote in the chat here that they don't allow a gradual return to work. So what you might ask for, if they don't allow it, is that you stay off, and then somebody like an occupational therapist helps you to regain these skills you're going to need for your return to work. Sometimes they're willing to work with you on that.
I don't know, Kim, you mentioned insurance. For me, it was a lot of people as doctors can just put that part-time. They can only work part-time. And then with the doctor's note, that forces employers to follow that a little bit more, at least.
Mm-hmm.
Yeah, ideally they want to set you up for success, right? You want to go back to work. They want you back at work. It's just setting yourself up to do it in a way that's going to build your capacity and your resilience, so that you don't flare up and then have, a bigger setback.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.